Hello, everyone, and welcome to United to Debunk Misinformation in Our Communities, a town hall on COVID-19. Before we begin, I'd like to cover a few housekeeping items. First, audio has been disabled for attendees. Click on the Q&A button at the bottom of the screen to view and ask questions. During the moderated Q&A session, selected questions will appear and will be addressed by panelists. Closed captioning is available for the session as well. Click on the closed caption button at the bottom of your screen and click on show subtitles for captions. We also have live Spanish interpreters available today. You can click on the interpretation button at the bottom of your screen to select the Spanish channel. Please note that this meeting will be recorded. You can submit questions anonymously in the Q&A if you'd like. For technical support, please email nnlm-scr@unthsc.edu. Thank you again for attending and participating in today's conversation. I'm now turning it over to Dr. Vishwanatha.
So welcome everyone to this town hall. It is my pleasure on behalf of all my colleagues to extend a warm welcome to you. My name is Dr. Jamboor Vishwanatha. I go by JK Vishwanatha. I'm a professor at the UNT Health Science Center in Fort Worth, Texas. I'm also director of the Texas Center for Health Disparities and a new program called the NIH Community Engagement Alliance Program. So this town hall is a partnership between the CEAL program, the National Research Mentoring Network, and the Network of National Libraries of Medicine. And I thank my team, Molly O'Brien, Brian Leaf, and Brady Burns, for having spent a lot of time in putting together this town hall. I would also like to thank all of the speakers and panelists before we get started with our program. We have our keynote speech from Honorable Sheila Jackson Lee, who is a U.S. representative from Harris County, Pastor Mia Wright, Ms. Venus James, Monica Hooper, and Dr. Peter Hotez. I thank all of them. They're all very busy people, but as soon as we contacted them, they immediately agreed, and they were very enthusiastic in participating in this town hall. I also want to point out that Representative Sheila Jackson Lee was the prime motivation for putting together this town hall. She learned about the CEAL program and immediately wanted to know who is doing this work in Texas, and she wanted to know how she could help. And based on her calendar, we set today's date, January 14th. She thought this was going to be a dead week in between the confirmation of the president-elect and then the inauguration. But Washington doesn't stick to any kind of calendar. A lot of things happened this week. So she had to end up in Washington. And unfortunately today, she'll be flying back. She's actually on a flight flying back. But just to show her interest, she wanted to record her presentation. And in between all of the meetings she had today, she did record her presentation, and you will get to hear that. I mean, that kind of a strong support from an elected representative really goes a long way, and we all want to thank her for her contribution to this. So I want to talk a little bit about what we are doing with regard to engaging the community towards the COVID-19 and the disproportionate effect that COVID-19 has had on our community. As you know, Texas is one of the hardest hit states, and within Texas, there are a few of the communities that are actually very, very hard hit. So when we started this community engagement program in September of 2020, there were 5 counties that were at that point were very hard hit, but now El Paso is also joined to that. So we are currently working in 5 counties: Dallas, Harris, Bihar, Tarrant, and Hidalgo counties. And we are engaging academic institutions, we are engaging local governments, we are engaging community partners in providing proper information. We are communicating what is going on with the COVID, the vaccination and the clinical trials. We are looking at some of the data on what the baseline information is and how people's perceptions are towards each of these. So what I would like to do, can we go back one slide, please? So I would like to talk about what we are doing in each of our communities. So next slide, please. So in Dallas, Dr. Rebecca Seguin Fowler is heading a project where she's involving the Texas A&M AgriLife, which has a statewide network in all 254 Texas counties. We are also engaging community partners, DLA, Mujer, Latina, that Ginés will be talking about, some of the community partners. Next slide, please. In Tarrant County, Dr. Emily Spence has been working with our local United Way, Dan County Public Health, YMCA. So we have a research project going on in Tarrant County. Next. Next, Dr. Luis Torres Hostos at UTRGV. He's a dean of the School of Social Work, and he has been engaging their area health education center and a local activity called Operation COVID Shield in their area, which is the Hidalgo and the surrounding counties. Next slide, please. There are Harris County obviously is a very big county with a lot of activity going on. There are 3 research projects that are currently going on in Harris County, led by 3 individuals, Dr. Bettina Beach, Dr. Jasmine Opusanju, and then Dr. Lorna McNeil. So they are engaging a number of organizations such as the Kando Houston, federally qualified health centers, many area churches and service organizations in 3 different community engaged projects that they are leading. Next slide, please. And in Bihar County, Dr. Robert Ferrer at UT San Antonio Health Center is working with, again, some of their religious organizations, the Bihar County Health Collaborative, as well as the San Antonio Health District for their project on the SEAL. Next slide, please. Obviously, we are looking at all the data we're collecting. We would like to know which of our community engagement activity works and which one we need to be looking at for future activities like this. And Dr. Chris Amos at Baylor College of Medicine is heading our data monitoring center. So I wanted to give you a flavor of all of these activities that are going on around Texas. And that leads to our town hall today, where we are talking about the importance of looking at COVID and all of the disparities that are occurring to that. And then using the presentations from trusted leaders in our community, we wanted to provide you information that will overcome some of the mistrust, hopefully some of the mistrust and the misinformation. Today, we are very happy to have Melanie Lawson, who is anchor at ABC 13, moderating this session. We gave her a very short notice, and we are grateful that she was able to rearrange her schedule and be able to be present for this. Briefly about Melanie Lawson, she is an award-winning journalist in Houston. For those of you in Houston, you see her every day as co-anchor on Live at 5. And she's also on the midday show, the Eyewitness News at 11 a.m. She hosts a weekly community affairs program called Crossroads. She does a lot of work, even though she covers all types of activities. She's still very much interested in the community-oriented activities. She's particularly interested in stories about children and also how people are making difference in their lives. She has received numerous awards. The YWCA gave her the Outstanding Women of Year Award, a Women of Distinction Award by Crohn and Colitis Foundation, and then the Ben and Julie Rogers Ecumenism Award from the Anti-Defamation League. So she's a highly respected person in our community, and we are happy that she will be moderating not only this town hall, but also the question and answer session at the end. So Melanie, welcome to this town hall.
Well, thank you so much, Doctor. I appreciate that, Dr. Vishwanatha. I can't think of a better person to really be putting this together. He is being very modest about himself, but he's been actively involved in mentorship and networking programs to diversify biomedical research. And what an important issue that is as we learn every single day dealing with this pandemic. So I am just so pleased to be a part of this and to be talking about an issue that is really terribly important in so many minority communities. And that is not only being more susceptible to coronavirus and to the pandemic, but also being more reluctant to really take part in it. There's so many people who don't feel as though perhaps they should be involved in this. And I'll go into more detail about that later on. I will say a couple of quick things. I come at this now with a newfound respect for COVID-19. I was diagnosed with it myself the week before Thanksgiving, a wonderful time to do all that. It started with a cough and then progressed to headache, body aches, bit of a temperature, and extreme fatigue. And what we are learning now, and Dr. JK, you can certainly relate to this, is that a lot of those symptoms linger for much longer than you think. Especially the fatigue and lung issues. There's several of my friends right now who are battling COVID-19 kind of in the wake of the holidays, and they are discovering just what a bear it can be. I even had the infamous loss of taste and smell, which may be one of the strangest symptoms you can ever have. I felt like I was chewing styrofoam every time I had a meal. But I am happy to say that I was able to recover for the most part. That fatigue does linger for a long time. So there are days and nights when I find myself just kind of passing out on the floor as soon as I'm done for the day. So I just wanted to sort of let you know that this is not theory for me. I'm one of those many tens of thousands of people in this area who've already had to deal with coronavirus. And as we all know, it is getting more virulent and more contagious. But that is something that all of you, I would assume, have been keeping up with. And hopefully you have not had to deal with it yourself, or family members or loved ones have not had to deal with it. But it is an issue that we will be battling, I'm sure, for months and perhaps years to come, even after the virus. Well, I know Dr. JK has already mentioned that Sheila Jackson Lee was a major part of this event. She was not able to be here today because of all the reasons you might assume. What started off, as you said, Dr. JK, as a quiet week before the inauguration has turned into a monumental event for all of us. And we've no doubt been watching that live on television for the last week or more. Let me tell you just a little bit about her. She is serving her 13th term as a member of the U.S. House of Representatives. She represents the 18th Congressional District of Texas, which is centered in Houston. And of course, we all know this is the energy capital of the world. She is dedicated to upholding the constitutional rights of all people, has a very diverse district, and certainly is very proud of that. She sits on 3 congressional committees. She is a senior member of the House Committee on the Judiciary, which had a great deal to do with the impeachment hearings the last few days, and Homeland Security. And she was also appointed as a member of the crucial Budget Committee. She is also the past ranking member of the Homeland Security Subcommittee for Maritime and Border Security, and has co-authored a bipartisan bill, which has been touted as the best vehicle for accomplishing comprehensive immigration reform in the Congress. She was named by Congressional Quarterly as one of the 50 most affected members of Congress, and U.S. News and World Report named her one of the 10 most influential legislators in the U.S. House of Representatives. Her resume goes on and on, so I won't try to tell you everything, but I will let you know that she was kind enough to tape something for us to really kick off this program today. And I thought you might want to enjoy that. I should also she mentioned that she is past chair of the Congressional Black Caucus Foundation Board, as well as a past chairperson of the Texas Congressional Democratic Delegation for the 113th Congress. So without further ado, I would like to turn it over, at least on tape, to Congresswoman Sheila Jackson Lee.
Good evening. What an opportunity to join you this afternoon going into the early evening I'm in Washington, D.C., and will be in flight as this very important session begins. Dr. Jamboor, I did not want to miss this opportunity to engage in a very important meeting and very important discussion that CEAL is involved in. Let me thank the distinguished pastor, Wright, the distinguished Ms. Ginés, and the distinguished Monica Webb Hooper, and of course, Dr. Peter Hotez. I want to make sure that I have pronounced Ginés's last name correctly, but Ginés, I hope, is correct because you're deserving of the respect. I'm Congresswoman Sheila Jackson-Lee, and I chair the bipartisan COVID-19 task force. I was the first member of Congress to make an announcement in the early part of February about COVID-19, believing that we were about to face a phenomenon that we might not be as reckoning prepared as we should. I'm a senior member of the Homeland Security Committee, third in seniority, and have worked on various issues dealing with infectious diseases such as Ebola, the West Nile, and actually did legislation to place on the cans of mosquito spray with ZEET to ensure that that word was placed on the can. Almost 2 decades ago, it was not in a conspicuous manner. So I have been interested in the potential of pandemics throughout my congressional career, and particularly work a lot with disasters. Unfortunately, we are plagued by hurricanes, but have been in many other areas from Pakistan to Alabama dealing with natural disasters. And of course, we must be well aware of those disasters that are man-made, such as, if I might say, the horrific and tragic act of January 6th, which might in fact be a COVID-19 occurrence, inasmuch there were throngs of individuals without masks, but reckless domestic terrorists plagued this capital, this citadel of democracy. But we're still standing. We look forward to an inauguration to bring in new breath of fresh air and leadership that I hope we will be able to take all of your ideas into the administration. Let me acknowledge the fact that among Americans 35 to 44, almost 48% of those who died were Hispanic, compared to 28% of Black people, 15.5% of whites, according to the first numbers of death. Researchers have found that more than half of all hospital deaths due to COVID-19 during the first 6 months of 2020 were among Black and Hispanic patients, according to a new study led by researchers at the Stanford University School of Medicine and Duke University School of Medicine. I know that because I engaged with the medical personnel at the Presbyterian System hospitals in New York. And what was happening, since they had not diagnosed COVID-19, poor people were coming to the emergency room, sent home with aspirins and various other, if you will, over-the-counter medicine, and they literally died in their tenement apartments. So they died in public housing in large numbers. Black and Hispanic people make up 58% of all patients hospitalized for COVID-19, and 53% of them have died from the disease. I've spent the last year hearing about various friends who have had COVID-19 who are African American, and as well, I have tragically had to attend funerals of those as well. Yet a disproportionate number of Black and Hispanic people become sick enough to be hospitalized. That is something to recognize. But as we know that we're almost reaching 400,000 deaths, maybe by the inauguration, this disease hits everyone. And so now, after the massive effort to test, which did not roll out well, I happen to have opened 50 testing sites in our community. I went into our communities, our Hispanic communities, our senior citizens, and as well African Americans, because I knew that without anything else, without any other tools other than going into the hospital, we had to diagnose those individuals who are asymptomatic and others so that we could stop the community spread. These are the issues that we must begin to grapple with. I believe we have to be more prepared. America has to know that the world is getting smaller and that we too may face this idea of pandemics. This may not be the last, because people travel from one part of the world to another part of the world, not just from one state to another state of our 50 United States. And so I've been working on this issue for a very long time, or at least during this 2020 period, with our COVID-19 task force, meeting with Dr. Fauci. I had him meet with doctors by Zoom in the early summer, as well as talking with the former director of cybersecurity to find out what kind of infrastructure we had in terms of the medical care and using cyber to be able to help with taking care of those that utilize telemedicine. As you well know, we've had hotspots here, but we've had hotspots where my friends live in South Texas. We've had hotspots in El Paso. Many friends there. I travel there frequently. I'm reminded of the terrible tragedy of murders that El Paso had and spent a lot of time there on funerals and working with my colleagues. And so what I think is important for us to be discussing is to recognize that we must educate the population about getting vaccines. That is important. There should be no person of color, no person of any other background that should be buying into the vaccine stories of those who are anti-vaccine. This, I believe, is well vetted, but I also believe we should open up the various vaccine research that's coming and vaccines that are just about ready to go to market. We've got to do more in the federal government to get these in the market. We know that a number of our own physicians, Dr. Peter Hotez and a number of others, are in the middle of vaccine production, vaccine research, and we need to work as a federal government to ensure that that is what we're doing. So what is my ultimate point of this work? And that is I am sensitive to calling it herd immunity because that was a sensitive issue under this past administration because it was recommended just send somebody out sick, let everybody get sick, and then there'll be herd immunity. I'm not for that kind of callous interpretation of herd immunity. So I've written legislation that the acronym is get vaccinated urgently or get vaccinated now. This legislation is being introduced today. I've spoken to many of you about it. It is to take over this idea of vaccination. What Warp Speed did was do the research and produce the vaccines. It had no plan other than the private delivery system to get these vaccines anywhere. I was physically at Harris Health, on that first day when the vaccines were coming, and we were literally waiting for a delivery truck that wasn't designated for delivering vaccinations. I literally helped take the little box off the truck. It was a great honor, but the idea of that, tracking a number, the federal government should take over the distribution along with FEMA to be able to have an inventory system, a logistics system, a cyber system to ensure that you as a provider are not waiting. You're not waiting. You know when your delivery is. The reason why we cannot open mega centers in Houston ready to do it is because we don't have a federal nationalized system of doing so. That's the proposal I want to bring to the Biden administration. They'll be offering their suggestions this evening. Mr. Biden will offer it. He knows we're in a devastating point, and he will be talking about 100 million vaccinations. We can do that and have the second part of the vaccination on these first Pfizer and Moderna if we know that what we have to do is to ensure the greater production. My legislation will implement the Defense Production Act. Produce. Again, it will be able to track the vaccine as developed. It will develop and deploy a fully staffed and resourced 24/7 advanced real-time tracking system. We'll bring in volunteers from the military, former nurses, etc., to have a national team that goes out like FEMA and gets to every nook and cranny and begins to vaccinate every single person. If I use the word test, please forgive me. And then we'll have a communication system. We'll have an app system for public health system. We'll secure the right kind of transportation for delivery. We'll provide a direct vaccine inoculations to all of the people. And we will have a capacity and competence to react to indications that a vaccine in transit may be at risk. And we'll provide an ombudsman to support public and stakeholder input, and that will be all of you, and provide HHS with the capacity to manage the inoculation data, but we'll use FEMA as the agency that can, in fact, ensure that all the federal agencies are working together. Let me thank you for giving me the opportunity for doing this message this afternoon or this evening, and I look forward to your discussions afterwards when I will hear the report. Again, I thank you for working with my staff here in Washington. Best wishes for a wonderful conference. We can do this. Please support my legislation, which is get vaccinated now. working with the federal system to help the state and local system. Thank all of you. God bless all of you, and God bless the United States of America.
And we want to thank Congresswoman Sheila Jackson Lee for that wonderful introduction to what we are talking about today. She really has put her time and energy where her mouth is. She has been out at virtually every site around the city and around the county, making sure that people get vaccinated. First, that they get tested, and now that they get vaccinated. I also want to turn it over right now to co-pastor Mia Wright and tell you a little bit about her. She is a real mover and shaker. She is co-pastor and executive director of ministry at the Fountain of Praise, along with her husband, Pastor Remus Wright. They lead a congregation of more than 20,000 members, if you want to wrap your head around that, making theirs one of the largest churches in the U.S. She leads the volunteers ministries for the Fountain of Praise. Well, in addition to church leadership and professional speaking platforms, her real passion is as the executive director of the Metamorphosis, Inc., a women's empowerment organization. It encompasses the life-changing Metamorphosis Women's Conference based in Houston, a mentoring program for young ladies, a compassion outreach, empowerment seminars, and international programs. Through her work, thousands have embraced lifelong transformation to a place of fulfillment and purpose. She is also a noted community influencer, way before influencer was cool, believe me, and a woman to watch in Texas. Her efforts in the community have been widely recognized, earning her a long list of accolades from many distinguished organizations. Of note, she was named one of Houston's top 30 women, most inspirational person of the year by streamingfaith.com, and a featured citizen in Who's Who in Black Houston, the 2010 edition. She's just also out there working in the community all day, every day. And it gives me such pleasure to introduce to you Mia Wright from the Fountain of Praise Church. Pastor?
Melanie, thank you so very much for your kind words and for the introduction. Good afternoon or good evening. I'm Mia Wright. I have the pleasure of serving alongside my husband, Dr. Remus Wright, in a very loving and spiritual and informed congregation, the Fountain of Praise here in Houston. Let me begin by sharing that before I became a pastor and before my work became mainly in the Christian community, my professional career actually began in the pharmaceutical industry with Merck, then followed by AstraZeneca as product specialist and developmental trainers with these organizations. So it's with this lens that helps me to understand and value truly the magnitude of the speakers that are on the platform today. And it is an honor to be alongside so many distinguished guests and leaders for this panel. Our Congresswoman, the Honorable Sheila Jackson Lee, who spoke so urgently and eloquently to the need for us to debunk the information within our communities and to help people to know that there is hope, even with the vaccine through this pandemic. To Dr. Webb Hooper, Dr. JK, Dr. Peter Hotez, and mi hermana, Ms. Ginés. So thank you all for the invitation to be a part here. Debunking the myth or the misinformation is such a necessary topic for us. Truly, when we think about it, no one can deny the level of misinformation that is surrounding the COVID-19 pandemic. What an appropriate social and community response that each one of us can agree upon. The vaccine, oh, the vaccine. There's so much misinformation and so much information that is available on this pandemic. And when we couple it through the lens of distrust within the medical community, particularly for people of color, this can compound our crises. It's true that African Americans have suffered from some of the unethical practices of some actors within the medical community. For example, and perhaps the most well-known is the Tuskegee trials. To speak about anything in the medical community and Black people, it's almost as if we must speak about it or else we're ignoring the elephant in the room. Many people in general have learned of the story of Henrietta Lacks, the Black woman whose cells helped fight against cancer, but it was unbeknownst to her family, who did not profit anything while pharma companies continued to profit off of research that utilizes her cells. And information about now the father of surgical gynecology, Dr. J. Marion Sims. That information is now being made more public and more transparent to the general population. He was a white 19th century doctor who perfected surgical experiments and procedures that he did as experiments on enslaved Black women without their consent, and even more tragically, without anesthesia. Simply stated, African Americans have suffered from unethical practices, and it's a fact that no one can deny. Because of this history, African Americans are less likely to trust the medical community and less likely to be in a clinical trial, and definitely less likely to want to try a newly marketed drug. Data show that African Americans and whites differ in their willingness to participate in medical research, with African Americans believing that minorities will bear most of the risk of the medical research. It brings me to the question of what are we to do? What are we to do today about this? I asked a small sample of people what they wanted to know about the vaccine. And while the majority of responses centered on safety and efficacy, one response stood out. I want to know if someone who looks like me took it and what were their side effects. What are we to do? If we do nothing, we know what can happen. To be honest, 2020 has shown us that there were plenty of funeral homes who were working overtime because of this pandemic. It continues to grow and it continues to get worse. Our hospitals are stressed, our economy is under pressure, our educational system is challenged, our houses of worship are empty. What are we to do? Please allow me to share my thoughts on this. I thought of 3 things that we can do to dispel the misinformation. And the first was to be informed with truthful information, know the facts. One of the absolute best things that each one of us can do is to ensure that we learn for ourselves what is factual and that we share facts and truth, not just what we read on the internet, but that which comes from reliable sources, because facts actually matter. The Old Testament prophet Zechariah admonished us to speak the truth to each other and render true and sound judgment in our courts. In other words, he said, don't be guilty of fear-mongering, of sharing and deliberately misleading others with your words by not telling the truth, by raising public fears about a subject that could have an answer. The vaccines are effective. The vaccines do have side effects. Perhaps you've listened to a drug commercial on TV and we're astonished at the super fast talking side effect disclaimer that happens near the end. We all have heard it. This drug has been able to show the following effects. And then we're astonished by the list of things and how fast they rattle it off. It can be quite alarming. And I'm certain that the other panelists today who are far more prepared to speak about this and qualified to speak about it than I will talk about that. But I want to say this, everything in life has risk. Nothing is without a potential side effect. There is a cost for everything that we do. If we do not know everything about the vaccine or the virus, what we do know is that yesterday alone, January 13th, 2021, that 3,922 people did not make it home. Somebody's father didn't get to say goodnight to their kids. Somebody's grandmother didn't get up to make breakfast. Somebody's employee did not show up to work today because they died from COVID on yesterday. Those thoughts can be very sobering because they're not just numbers. These are people, their family, friends, co-workers, neighbors, and even strangers. We must be informed with the truthful facts. And that brings me to the second thought, is don't be fearful. The Bible is replete with stories and examples of people or a group of persons who encountered a frightening situation that held some uncertain outcome or a future that was unclear or uncertain. Their experience often included a charge for that person: be strong and be courageous and don't be afraid. When that person or that group challenged what was in front of them by praying and by action and forsaking fears, they realized that they had overcome their fear and they didn't allow fear to keep them back. It said that these words, do not fear, do not be afraid, they appear in some form in the Bible, get this, 365 times. That's enough encouragement for every person every day of the year. Fear will hold you back from everything that you desire because it is such a powerful emotion that it will help you or it can hinder you. And we should each examine our fears to understand if they're warranted or if they are based in something unwarranted. Be informed with facts and don't let fear rule your life. The third and last thing is remain optimistic and faithful. And as I thought about this, I thought about how we express our faith. Our faith is not truly exercised until it pushes us to a place that is beyond our comfort zone. Until we're able to get to a place of having to trust something bigger than ourselves, not man, not medicine, but trust God, who is bigger than all things. Faith is the substance of things that are hoped for and the evidence of things unseen. Our faith is in things that we hope for. We are encouraged to be wise in our living and in our decisions. I had one extremely encouraging conversation this week with a young father, and he had stated initially that he was not going to take the vaccine. By the end of the conversation, he was saying he was at least open to learning more about it, and then he would prayerfully make his own decision. I like that. I like it because I believe that prayer will guide our lives' directions. It will give us the level of peace and comfort about the decisions that we make. Every person will need to decide whether or not they should or should not take the vaccine. The decision can be made by prayer, by arming yourself with the truthful and the proper and reliable information, talking with your healthcare provider, and making that decision for you. Facts, fear, and faith are extremely important elements to consider. The faith factor in science and medicine is not that we trust everything, but we trust God, who is God above all things. In the words of the late Nelson Mandela, I speak these to you. May your choices reflect your hopes and not your fears. God bless you, and thank you for allowing me to share with you today.
Thank you so much, Pastor Mia. We really appreciate that. What wonderful words. Facts, fear, and faith should be the three things that we focus on. Our next presenter is Ginés. I love this name so much. She is the president and founder of Dia de la Mujer Latina Incorporated. She earned a BA from California State University and her master's from Georgia State University, focusing on the cultural and system barriers faced by Latinas with breast cancer. She was appointed to the NCI's first Director's Consumer Liaison Group, and in '97 was invited to present at a congressional panel for the recognition of the term Latino as a proper category term for the new population from Latin America. It also helped to initiate her advocacy work for cancer and women's rights. Nationally, she serves on many boards, appointed to the Blue Ribbon Panel of NCI Health Disparities Progress Review Group in Washington. She has chaired the Trans HHS Cultural Competence in Education and Training Roundtable. She's received so many awards and accolades from small institutions like CNN, Latino, Fox News, and Univision. She is also a Leadership Atlanta alumni, a former adjunct professor at the Morehouse School of Medicine, and currently an instructor at Baylor College of Medicine. In 2009, she was the first Latino CBO approved by Texas for state certification training, and she's also been elected to the HHS National I'm not going to say this correctly, but the National Steering Committee, and in fact was voted chair. So it gives me such pleasure to introduce to you Ginés.
Buenas noches. Can you all hear me okay?
We sure can.
Bueno. It was Mia, my sister. It was hard act to follow. You are amazing, and I love you dearly. First and foremost, what I like to say is this. I'd like to thank the committee for recognizing and inviting those of us in our community, in our faith-based and grassroots organizations to present. Normally, I've seen a lot of town halls where there's a lot of science and a lot of medical experts talking, but rarely do we have the distinction of having a faith-based and community-based organization being involved in presenting what's going on in our community. The other thing I wanted to say is that I have been working with this wonderful group, the Texas CEAL, and I am the community representative for Texas in the communications network, and I have learned a lot about misinformation. But further back, I wanted to let you know that in February 2020, I and a group of 5 friends put together a training program for promotoras and community health workers on the topic of COVID-19. Now, this is February, and we taught the first class on February 25th and then on March 5th. And the reason I'm saying this is because we already knew that something was going to happen, something's going on, something's brewing, and it's going to hit us. And we realized that our community was going to be victims of some of these scam artists. We felt that a lot of information was going to be floating around and it's not going to be culturally and linguistically translated. And we felt that it's important for those trusted members of our community to be out there in full force to dispel myths, rumors, and misinformation. So as you can imagine, our work has not stopped since COVID. We knew that we needed to work with many other communities. So we created some partnerships with some of the other organizations to try to get more community health workers trained so they can be out on the road. We have been blessed with Harris County Public Health and the city of Houston calling on our organization to help them with promotores and community health workers because they needed all these contact tracers. And we were so happy to provide 273 wonderful applicants. And one of the things that I am very proud of is these community health workers and promotores. They are the true navigators. Many of them have lived some of those system and cultural barriers. They have these skills for communicating and listening to our community's needs. The interpersonal skills that they have in sharing information is unbelievable. And advocacy, you know, they're always advocating for those victims of domestic violence and folks that are going through a lot, especially those on the border who are going through a lot with this administration's anti-immigrant sentiment. So what I'd like to also share with you is the fact that we're not sitting here just thinking, okay, what are we going to do next? We immediately, thanks to some of our sponsors and donations that we received, we were able to set up 10 hotlines across not only Texas, but other parts of the United States. Our organization, as you can see, we're in Puerto Rico, so we've set up a camp over there in Puerto Rico. We have also, we are working right now on a call center, which is to me so exciting because we want to make sure that our community gets to see what we're doing in Puerto Rico and in the Valley and El Paso and so many other communities where we have seen the impact of COVID-19. And so for this reason, we are launching a very innovative program. And I didn't even realize that I didn't have the video here, but y'all can see me. We are launching something that is very near and dear to my heart. It is no más, no more. Misinformation plus miscommunication equals mistrust. When I worked with Baylor's Baylor College of Medicine and the Intercultural Cancer Council on the EDIC project, EDIC stands for Eliminating Disparities in Clinical Trials, we found from all the 8 regions in the country where we spoke with many diverse patients, cancer patients, and even diverse physicians, that there are 2 things that were really the barriers in our community is communication and information. So information should be at a level where people can understand it. So it needs to be applied in such a way respectful of the health literacy of that community. And then you have your communication. The people that are best communicators are your promotores and community health workers. And so our call center is going to be manned by community health workers and promotores. We will still continue with our hotlines, but what we're doing now is dispelling myths, rumors, and misinformation. Our goal is to try to get to as many states as possible and engage with some partners that we have across the country. And hopefully Texas is going to be the nucleus where we're going to try to build the infrastructure for our community health workers and promotores all over the country. If we can't find the answer to their question, we will look for it and we will find it, but it'll be evidence-based information. And so I will leave. I know I've used my 10 minutes, but thank you so much, and God bless all of you. And y Dios os bendiga a todos. And I love my promotoras and community health workers. And remember, class on Tuesday.
Thank you so much, Venus. What a wonderful presentation. In fact, between Mia Wright and Venus, we have really gotten a sense of what's happening in communities of color and why that mistrust is so strong. The next person I want to introduce you to is Monica Webb Hooper. She is the Deputy Director of the National Institute on Minority Health and Health Disparities. She has worked closely with the director there and the leadership to oversee all aspects of the Institute and support implementing the science visioning recommendations to improve minority health, reduce health disparities, which we know have really been shown to be very vast during this time, and to promote health equity. She's an internationally recognized translational behavioral scientist and clinical health psychologist. She's dedicated her career to the scientific study of minority health and racial ethnic disparities, focusing on things like chronic illness prevention and behavioral change when it comes to health. Her program of community engaged research focuses on understanding many factors and biopsychological mechanisms underlying modifiable risk factors. Wow, that's a mouthful. But it breaks down to simple things like tobacco use and stress processes and developing community responsive and culturally specific interventions. Her goal is to contribute to the body of scientific knowledge and disseminate findings into communities with high need. And certainly we are in great need of both of those things at this point. So Dr. Hooper, it is your turn to take it away.
Well, thank you. Thank you very much for that kind introduction. And a special thanks to Dr. JK and the CEAL Texas Consortium for hosting this important event. We are here in the spirit of being united, along with the goal of debunking, and these are both very important topics. And I'm pleased to have this opportunity to contribute, especially alongside my esteemed co-panelists. So I am here to discuss the National Institutes of Health Community Engagement Alliance Against COVID-19 Disparities, or as you've heard, the CEAL initiative. So I'd like to start by acknowledging that CEAL is a team effort. It is led by directors of two NIH institutes, Dr. Gary Gibbons at the National Heart, Lung, and Blood Institute, and Dr. Eliseo Perez-Estable at the National Institute on Minority Health and Health Disparities. Next slide. I also work very closely with Dr. George Mensah to provide daily oversight of CEAL, and we have a stellar team that has worked tirelessly for the past 6 months to stand up this mission-critical initiative. Next slide. So we all can agree that this pandemic continues to take such a toll on the world. And in 2020, COVID-19 was one of the leading causes of death in the United States. And these are very staggering statistics. And it is important that we always remember that there are real people and families behind the numbers. Next slide. So when we discuss COVID-19 and its many impacts, we must talk about health disparities. These are national data from the CDC, which indicate racial ethnic disparities in COVID-19 cases, hospitalization, and mortality. A few examples are highlighted in the purple boxes. So compared to white individuals, COVID-19 cases are 1.8 times higher among American Indian or Alaska Native persons. Hospitalizations are over 4 times higher among Latino or Hispanic individuals, and deaths are nearly 3 times greater among Black or African American persons. And an important point about health disparities, these are differences that do not have to exist. They should not exist. They are modifiable, and that means that we have the opportunity for change. Next slide. And as we all hope to end the pandemic as soon as possible, widespread acceptance of COVID-19 vaccines across populations is critical. And among the concerns are data pointing to low willingness to get a vaccine. And these survey findings, I apologize, the slides are kind of showing very strangely, but these are survey findings reported in December, and they actually reflect overall improvement of about 9 percentage points in willingness to accept a COVID-19 vaccine relative to the numbers reported in September. Yet the percentages are much lower than what we need to see, particularly among African Americans at about 40%, but the percentages among white adults and Latinos are also lower than what we'd like to see. And even among individuals who are regularly vaccinated against the flu, African Americans are more than 2 times as likely to report that they would not seek the COVID-19 vaccine. Distrust is high for many well-justified reasons, and it creates a major uphill battle that must be addressed to improve population health, get us on the other side of the pandemic, and to reduce health disparities. Next slide. And the COVID-19 infodemic is also contributing to distrust. Now, an infodemic is a rapid and far-reaching spread of a mix of both accurate and inaccurate information. And the misinformation flow is excessive, which makes it difficult to separate fact from fiction and to have confidence in a solution. A key concern about the COVID-19 infodemic is the particularly adverse impact it may have on communities most affected. Next slide. So there's much work to be done to address misinformation and also disinformation, which refers to the deliberate spread of misinformation in the community. And CEAL is working on this from a national perspective that is debunking misinformation and building trust, particularly in disproportionately affected populations. Next slide. So combating COVID-19 misinformation and conducting community engaged science is complex. It requires significant effort, and that we follow certain principles that will facilitate our success as a collective. And here are 4 of such principles, and there are many others. They include building and maintaining trust, bi-directional relationships, and we do this by showing up, well, virtually, that is, or with physical distance in the age of COVID. But we do this by showing up, we do this by working with and serving the needs of communities. We address social determinants of health, such as ensuring access to high quality, accurate, and community competent programming. And as one of our partners said so eloquently, we move at the speed of trust. Distrust cannot be overcome overnight. So this is about meeting individuals and communities where they are, being present for the long haul, and demonstrating trustworthiness. Dr. Fauci is for many the most trusted national voice, and trusted messengers who understand the dynamics of the local context are also critical. And that's one of the goals of CEAL. Next slide. So the CEAL Alliance currently includes 11 states. When CEAL started this summer, we focused on the then areas of the country with surging cases and a disproportionate COVID-19 burden among racial ethnic minorities. And in each of these locations, there are also research teams with a reputable track record of community engaged science who demonstrated through their applications that they would be poised to rise to the urgency of the times and do this important work. So the state-based teams are working in counties in the states that you see listed here and highlighted in blue. And we are delighted that the state of Texas is part of the CEAL Alliance and doing such impressive work. Next slide. The overarching goal of CEAL is to understand factors that contribute to the disproportionate burden of COVID-19 in underserved communities. This is a co-learning experience where the CEAL teams are learning from communities in various ways, such as focus groups and listening sessions, and communities are learning from the CEAL teams through outreach and education activities. This co-learning leads to the co-creation of culturally specific messages and other interventions that will be tested for effectiveness. And this evaluation piece of CEAL is essential to understanding both reach and impact. And we also are engaging trusted voices and experienced research teams in one of our initial areas of focus this past summer and the fall, which was ensuring that racial ethnic minorities were aware of opportunities to participate in COVID-19 vaccine clinical trials. And while many were skeptical, especially early on, turns out that there were benefits. I'm now thinking about members of my own family who participated, and now they are vaccinated and protected from severe disease. So overall, CEAL is investing in communities through a multi-sector alliance committed to the mission of reducing health and other types of disparities. Next slide. In a short time, the CEAL Alliance, both the NIH staff and the research team, are firing on all cylinders. Here are just a few of many examples of the activities happening in partnership with local communities. These teams are on the ground, fostering clinical trial inclusion, conducting community needs assessments, and building awareness about how to stay healthy while providing personal protective equipment, hand sanitizer, and other needed resources. Next slide. So I want to give you a few early metrics specifically on the reach of CEAL. In less than 4 months, there are over 2,300 outreach staff in direct communication with community members to advance the work of CEAL. About 48,000 individuals have received COVID-19 educational messages on behalf of CEAL, and the teams have conducted collectively more than 2,200 activities, including text messaging campaigns, distributing materials, hosting their own webinars and town halls, and having local community meetings. Next slide. So also important for CEAL is that the leadership, both within NIH and across the research teams, have supported national and local town halls, Facebook Live events, media stories, written op-eds, and other efforts to deliver evidence-based information about COVID-19, including demystifying COVID-19 vaccines and answering the questions on the minds of many of us. Next slide. So we're all proud of the work that CEAL is doing, and we recognize that this is an effort that still has a long road to travel. These are a few sources that I encourage you to review for accurate information on COVID-19, get the facts, and also key initiatives that are part of the NIH scientific response. And finally, I challenge and charge you to help us both unify and debunk misinformation, and to do everything within your domains of influence to have a positive impact for the betterment of our community at large. Next slide. I just also want to thank you very much for the invitation again and for your attention.
All right, thank you so much, Dr. Hooper. That really put it in great perspective. We appreciate it. Well, she talked about Dr. Fauci, who all of us have gotten to know on the national level because he has appeared on so many different television shows and been interviewed just about everywhere. We have our own version of Dr. Fauci, and that is Dr. Peter Hotez, who is with the National School of Tropical Medicine. He's the dean there. He is the professor at departments of pediatrics, molecular virology, and microbiology, and co-head of the section of pediatric tropical medicine. But it is as a scientist, a pediatrician, and advocate in the fields of global health and neglected tropical disease control that he's really helped so many of us understand the difficulties of the virus that didn't exist a year ago this time, but now has ravaged both our area and our country. He is also director of the Texas Children's Hospital Center for Vaccine Development and Texas Children's Hospital Endowed Chair in Tropical Pediatrics and University Professor of Biology at Baylor University. Previously, he was president of the American Society of Tropical Medicine and Hygiene and is a founding editor-in-chief of PLOS Neglected Tropical Diseases. He's also the co-director of Parasites Without Borders. I love that. A global nonprofit organization with a focus on those suffering from parasitic diseases in subtropical environments. And don't kid yourself, we are definitely in a subtropical environment here in Houston. He says his life has really been about keeping a foot in both spheres, being a working scientist, keeping up with grants and scientific papers and lab meetings on one hand, and also educating the public and the world about vaccines, vaccine safety, and poverty-related diseases, and now COVID-19. And he has just been a voice of reason and knowledge in so many instances. I think he's on TV more than I ever was, but we're so grateful to him for that. And before I toss it to Dr. Hotez, I do want to mention, I see some of your questions coming through, but if you've got questions, please put them in the Q&A section or your chat section so we can begin to answer them. Dr. Hotez is with a great deal of admiration and appreciation that I want to toss it to you now.
Well, thank you very much. I appreciate the opportunity and the very generous introduction. The hour's late, so I'll try to keep my remarks brief. To get a better sense of what's really going on nationally, I would look at the death report from the Houston Health Department. And Houston Health Department has been great at listing the number of people who've perished in this horrible epidemic in 2020 going into 2021. And what they do is they don't provide the names, of course, but they provide the age, sex, and race or ethnicity. And it says the same thing every day when you go down the list. It provides the age, which is sometimes in their 80s or 90s, but just as often in their 40s or 50s. And then when you get to race and ethnicity, you see the same thing every day. It's Hispanic, 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 Black, Black, Hispanic, Hispanic, Hispanic. And more often than not, what you're seeing are people in their 40s and 50s, because the sad news, among a lot of sad news, is that whereas most people think about COVID-19 as an illness of people over the age of 65, in the Hispanic and African American community, about a third. In the case of the Hispanic community, 35% of the deaths are under 65. So when you try to put a face behind our epidemic here in Houston or here in Texas, what's happening really is COVID-19 is robbing a generation of African American and Hispanic families of their mothers, their fathers, their brothers and sisters. So let's think about a 50-year-old Hispanic woman who loses her life. She has a few kids, couple of kids, some maybe in their 20s, working on construction sites, or still teenagers, a teenage daughter. This is the real tragedy of what's going on in COVID-19 that nobody speaks about, is how we're losing so many mothers and fathers and brothers and sisters. And we've not done a good, we've failed in so many aspects of COVID-19 control, which is why we'll be at 400,000 Americans who will lose their lives by next week or on the inauguration. But the piece that is seldom told is the devastation on the Hispanic and African American communities and those moms and dads. And so doing what I can to highlight that, and not last year, Congresswoman Escobar from El Paso and Congresswoman Garcia invited me to speak to the Congressional Hispanic Caucus, where I basically laid it out there. I said, this is causing historic decimation of Hispanic communities. I mean, just tearing apart families, and the same very much with the African American community. And we're seeing so much vaccine hesitancy, particularly among the latter. So what I've been trying to do is go on as many African American radio programs as I can. I was on KTSU over the weekend, and Pastor DZ Cofield generously invited me to go speak on his radio show last Sunday night. And we've got to do that because we're just losing too many lives, that for people that don't have to lose their lives, we have to vaccinate across Houston and across Texas. And the numbers are daunting. We're looking, I mean, if you look at the population of Harris County, that's 4.8 million people. Harris County has more people than many states in the United States. It's the second largest county in the U.S. after Cook County. Our studies show that we have to vaccinate about 3/4 of the population of Harris County in order to halt virus transmission. So those are big numbers. Those are 3.6 million people. And if we want to do this over the next 6 months, because we're in a race against death as the numbers of people losing their lives increase, we've got to now vaccinate 600,000 people per month. And on a daily basis, that's 20,000. And sometimes people are getting 2 doses of vaccine. So the numbers are just extraordinary, 20, 30,000 people every single day now for the next 6 months, maybe next 8 months if we're not as good. And we're just not set up for it. And so the question is, how can we do that kind of high throughput vaccination to get 20,000 people vaccinated a day? And I know this has been the number one concern of Houston Mayor Sylvester Turner, who I've spoken to a lot, as well as the county judge, Lena Hidalgo, And this is our biggest worry, that we just won't be able to get there. When we heard about Operation Warp Speed and all the logistics that were in place and having a 4-star military general, I guess at some level I thought, okay, we had the Army and the National Guard behind us figuring it out. But now it turns out that by logistics, what they meant was putting those boxes on the back of FedEx trucks, UPS trucks, making sure they were kept cold the whole way through. And then it was adios. They basically dumped off in the States, and now we're left holding the bag. Now we will figure it out. The question is how quickly will we figure it out? So in the way, my understanding, the way it works is in the Houston City District, the Houston Health Department's responsible for the vaccinations in the unincorporated areas of Houston and Harris County, not occupied by Houston. It would be Harris County Health Department. Of course, we've got Fort Bend and Montgomery counties as well. And that's going to be the big challenge. I was able to visit the Bayou City Center a couple of weeks ago to see how they were set up, which is one of the bigger sites. And I have to say, the Houston City Health Department, it was really well run. I mean, they had professional staff, they were knowledgeable, there was adequate social distancing, there was emergency resuscitation equipment on hand in case there was a severe allergic reaction, which is a little higher frequency than, say, a flu vaccine. A flu vaccine causes a severe allergic reaction around 1 to 2 per million. The mRNA vaccines are around 1 to 2 per 100,000, so still rare, but a bit higher. So they had that teams in place. So it was really well run, and I walked out of there, and my wife picked me up, and I said, it looks really great. And then the light bulb went off. I said, yeah, we need about 20 of these. And so how we're going to build up to scale is going to be the big issue. Recently, last week, the mayor opened up Minute Maid Park where the Astros play, and they got 3,000 people vaccinated. And I said, that's what we got to do, but more of that. So I think that's going to happen. We'll build out the Minute Maid Park as a metro, as a sort of a mega hub. But right now it's kind of this hodgepodge. We're still too dependent on the pharmacies. It's not the pharmacy's fault. They were asked to do it and they stepped up. If you ever go to the HEB website, it's a really good website. And that's how I get my vaccines, at the HEB pharmacy or Randall's or Kroger's or CVS. And that's fine. I just don't think it's going to be adequate for the throughput, the high throughput that we need. So we've got to have the pharmacies, we've got to have the medical centers, we've got to open up those big hubs. And the other thing that I've been speaking to the mayor and the county judge about is how to get these open in low-income neighborhoods, because as everyone on this call knows, it's not like there's an HEB in the Fifth Ward or an HEB in some of the low-income neighborhoods. So a lot of these places are pharmacy deserts. So how do we address that? So this has to be, I think, one of our biggest priorities is making it possible for anyone who wants to get vaccinated to get vaccinated. That's part one. Part two is the fact that I think some of the restrictions and rules on who can get vaccinated, who isn't, we've learned over in 2020 that we're not good at complicated things. The minute we can make things a little bit complicated, like for the diagnostic testing, the use really falls off. So how do we streamline our guidelines to make them as simple and unfussy as possible? And lastly, we're going to need more vaccines. Those mRNA vaccines, they're good vaccines in 2 doses, but there's not enough of them. It's still an immature technology. We don't have the ability to scale it up. We're going to have to get additional vaccines out there, including a couple of the adenovirus vaccines. I hope we'll hear about the Johnson & Johnson one soon. We have a vaccine that we're scaling up production. We're making 1 billion doses in India, and possibly that will come into it. So those are the kinds of things I think about. We also have pretty aggressive anti-vaccine groups. Texas is a big hub for the anti-vaccine movement. Organizations like Texans for Vaccine Choice, linked to the political extremism on the far right under this fake banner of health freedom, medical freedom. How do we neutralize a lot of those phony messages? And that's going to be daunting. We also have now anti-vaccine groups specifically targeting the African-American community. Last year, some of these anti-vaccine groups staged sort of these phony rallies in Harlem, the Harlem Vaccine Forum, which was deliberately targeting African American communities, just like they targeted the Orthodox Jewish community the year before using Holocaust language. We're going to have to do something about that, and so far, no one has shown much appetite. So there's a lot of work to do, and this is why I'm so grateful to have the opportunity to speak to you today in this forum, because I'm willing to do these every day until I can't talk anymore, because this has to be our number one priority. So the hour's late. I'll stop there and see if we have. I could take a few questions, and unfortunately, I'm going to have to jump off. But I appreciate the opportunity.
And we appreciate having you here, Dr. Hotez, and bringing everything in such an easy to understand manner. Well, I want to dive right in because we're getting some great questions in, and I'd like to begin there. And the first question may be the most sort of representative of what we hear a lot. And the question is, and this is from an anonymous attendee, if people social distance, wear their masks, wash their hands, have their temperature checked, and do all the other preventative measures, why do they need to take a vaccine? And Dr. Hotez, knowing that you will not be able to stay all the way through the end, this is a great one for you to take. And I'm sure you hear this a lot. Do I really need this if I'm doing everything else you tell me?
One of the things that we've learned is the way all of these vaccines work is they induce something called virus neutralizing antibody. And we've been working on coronavirus vaccines for the last 10 years. And we've learned that if you have virus neutralizing antibodies in your system, you won't get sick and you won't go to the hospital. So so the only guarantee that you can have that you're not going to a hospital and ICE or an intensive care unit is to get virus neutralizing antibodies in your system through a vaccine. The other measures, look, they don't go away. They're going to be important, but people let their guard down, and you get visited by other individuals, and this virus is super transmissible. And let's face it, when you're walking outside, or if you go into Kroger's or Rite Aid, there's just people not wearing masks all the time and they're shedding virus. Or if you go into any kind of a setting where you have more than 4 or 5 people, remember there's so much virus transmission going on right now. Anytime you're in a group setting where there's 3 or 4 or 5 people, I can promise you one of them has COVID and is transmitting COVID. And the masks help and the social distancing help, but they're not as there, and we have to do it, but there's nothing more powerful than having virus neutralizing antibodies to keep you out of the hospital.
All right, that is very, very helpful. And actually, in connection with that, here's another question, also from an anonymous attendee. How do you address the misperception that COVID vaccine is not needed if you've already been infected and recovered from COVID-19? And
Yeah, I
Doctor, I'll
mean,
throw that one your way once again.
all right. Thank you. So, yeah, I mean, the UK just came out with a study suggesting that if you have COVID-19, you've recovered, and you have good antibody response, you could be protected for up to 5 months. So that's good, but we don't know how durable the protection is beyond that. So the nice thing about the vaccine is it can really increase your levels of virus neutralizing antibody and protect yourself. So the recommendation is, even if you've had previous infection, to get vaccinated. And that may even give you a bigger boost, because if you think about it, having the vaccine is like having the infection is like having a third dose. First you get the infection, you recover, then you get your first 2 doses of vaccine, and that will likely give you more durable levels of protection. In an ideal world where we don't have enough vaccine to go around, what we would have done is to test your blood to see if you have antibodies already from previous infection, and then we'd ask you to hold off on getting vaccinated. But it's too hard to operationalize. There's just no way to do that simply. And so the fact is, if you look at the numbers right now, there's roughly 2 million Texans who've been infected. we know that, and those are confirmed cases, we know that's an underestimate by 4 or 5. So we're probably looking at 8 to 10 million Texans have already gotten infected. That's roughly a third of the population. A third of the population's already got infected, and 30,000 Texans have lost their lives also. So it's the single most destructive event in the history of our state. More Texans have died from COVID than all the Texans who sacrificed their lives in World War II or the Civil War or the Galveston flood. So, so that's pretty daunting stuff, and the numbers aren't going down, right? I mean, they're just going to keep going. They'll go to 40,000 and 50,000. So until half the population becomes infected in a couple of months. So we can't operationalize it, but we can ensure that you'll have more durable immunity if you get vaccinated. I'll take one more, and then maybe I'll jump off after that.
All right. And let me at least throw one towards Pastor Mia Wright, doctor, and then I'll come back to you. And this is one that we just got, a woman who, or I should say a person who works especially with seniors, and they don't trust the vaccine. They think prayer will make the difference. And so this is one that is directly in your wheelhouse, Pastor Mia. And I hope she is still there. Pastor Mia Wright, are you still there? We may have lost her. All right. Well, then I'll pass on that question.
Well, let me just add. There's nothing wrong with prayer. I guarantee it won't hurt you, and it may even help. It may even help the vaccine. I have to prove it, but I haven't proved it yet. But I'm pretty certain that prayer will help the vaccine, and it's not either or. I mean, this is why, God gave me an MD and a PhD, and gave me a mind that had a passion for science, is to save lives. And the way, God works through me, the way she works through me is through talking about vaccines and developing vaccines. So we got to get away from this dichotomy of it's either prayer or vaccines. I can tell you they go hand in hand and they reinforce each other.
Well, doctor, before you go, we do have a couple of questions about the vaccine, and you're talking about needing to do 20,000 a day, which is just an incredible number, just to be able to kind of cover the waterfront here. And so we have a couple of questions about that. One is, why is there a need to mask or socially distance after you've had a vaccine? And then the other question is one I'm sure you come hear a lot. And that is, why do I really need 2 doses? If I just take one, won't that cover me?
So I'll do the second one first. So,
Okay.
I looked at that, again, all these vaccines work through the inducing what are called virus neutralizing antibody. And one of the things, and so all of the companies and our vaccine as well, we all aspire to make a single dose vaccine because that'd be easy, right? One and done, then you're on your way. The problem was this, and when you give a single dose, what you found is that some people got really high levels of virus neutralizing antibody and are protected, but an equal amount didn't get much in the way of everything. So it took that second dose to bring everybody up to that high level. So that the problem is, if you get a single dose of the vaccine, you don't know if you're in the thumbs up group or the thumbs down group in terms of whether you have virus neutralizing antibody. So the way I say it is that, 2 doses is a vaccine, a single dose is a roll of the dice at the craps table. You just don't know. You just don't know where you fall, and that's why you need that second dose. I'm sorry, what was the first question again?
Oh boy, now I've got to go back and find it. The fact that
the asymptomatic shedding.
right,
Yeah.
exactly.
So the way these clinical trials were done was, if you were enrolled in those clinical trials in 2020, if you started feeling sick and you were on a list of symptoms, you notified your study coordinator, and the study coordinator tested you for COVID. And if you were positive, you registered as a case of symptomatic COVID. In other words, you had to be symptomatic to hit the radar screen to be counted as a COVID case. There was no mechanism for seeing if you had asymptomatic COVID. So we don't know for sure if this vaccine stops asymptomatic COVID as well. Because we know about half the people with COVID have no symptoms at all and are just shedding virus. So what does that mean practically speaking? So let's say, my wife and youngest daughter haven't been vaccinated yet. So or fully vaccinated, and I'm out there and I'm vaccinated, I'm going to work, whatever, I could come home and still be shedding virus and infecting them, and they're not protected. So until enough people get vaccinated, or until we know the vaccine stops that asymptomatic infection, we're going to be wearing masks for a while. Not forever, but I think for a little while longer.
For a while longer. All right. Well, Dr. Hotez, we appreciate your time so much. And if you have to jump off.
Thank you so much. And thank you for your eloquence. You were brilliant. You lived up to all expectations and more. So
I'm assuming you're talking to all the presenters.
Well,
and not to
definitely
me.
all the presenters, but I'm also speaking specifically to you. So thank you for all your hard work and your brilliance. I appreciate it.
All right. And we appreciate yours. So thank you so much, Dr. Hotez. Well, I want to go ahead and get into some of these other questions. And all of our presenters have talked about the difficulties of persuading people in communities of color. And there's another question here, and I'm trying to go back and find it, and I may have to just sort of paraphrase it here. And Dr. Hooper, this is one I'd really like to toss your way. It says, have studies been completed to address whether or not a vaccine is taken late? If there are, for example, the second dose, are there problems with consequences? Is there a good chance that someone who is getting either only one shot or taking it late in the process, that maybe it won't work as well? And I hope I'm translating that the way that person asked it.
No, I follow the question. And the thing that I want everyone to certainly remember is that because this is such a novel virus, all of the data are just emerging. And the phase 3 clinical trials, the Moderna trial, the Pfizer trial, are the first two who have completed this stage in the process. And thus, because of their data, have been able to gain FDA authorization through emergency use. So there are many questions that we don't have the answer to. And that's one of them. So we don't really know the answer to that question. And so I would be very skeptical to make any decisions or to listen to anyone who has an answer to that question, because the data we just are not there yet. But it's one of the questions that is currently being assessed. And at the moment, the goal is to ensure that once you get vaccine dose number 1 in the 2-phase regimen, that within a day or two on either side, whether it's the 21 days or 28 days, that you are there to get the second dose. Because we know from the data from the clinical trials that people did experience the immune boost and the antibodies after one vaccination, but the second dose is why the vaccination efficacy is as high as it is. And these vaccines, the 2 that we have available, perform very well with the 2-dose regimen. So we want to make sure that everyone completes the series. That's going to be very important to maintain your level of your antibody levels and your protection from severe disease.
Here's a great question that really kind of piggybacks off that. And it says, what are your views on giving 2 doses 6 months apart as opposed to 3 to 4 weeks apart? Is it better to vaccinate more people with perhaps half of a response versus fewer people being fully vaccinated? And especially given the fact that we have so many people who need the vaccines, and at least at this point, so few places for them to get it. And Dr.
That's
Cooper,
also, no, sure, I can attempt to answer this question. Many of the questions are certainly, you'll hear a repeating theme, which is that we don't quite know the answer to the question. But before you get to the phase 3 trials, there are phase 1 trials, there's phase 2 trials that happen that really are looking mostly at the immune response and the safety and efficacy. Where we are now is these clinical trials are 2-year trials. So the participants in these trials will be followed for 2 years. So even though we're at the point of vaccination because of the crisis and the pandemic that we're in, trial participants will be followed for 2 years. And that's really where we'll have more of the details about how long we are protected after vaccination and about the dosing and the multiple questions that are coming up. But at this point, based on the science, and I trust and follow the science, this is the recommendation that FDA has authorized in terms of the duration between the vaccination. So I would encourage everyone to stick with that and to not take any chances by delaying vaccination. I mean, I think I understand the question in theory is that, if our goal is to reduce cases and reduce mortality, then we should just vaccinate, and the supply is low or lower than we'd like right now, that maybe we should just vaccinate everyone once and kind of wait. But my understanding is that the doses are ramping up. As additional vaccines are approved, assuming that they show efficacy that will benefit population health, that's why we need more than 2 kinds of vaccines, and they'll have multiple platforms so that we can vaccinate and reach a level where we are at herd immunity. And that's a term that, you know, we've all heard in various forums, but that's where we want to reach. And so at this point, it's important that everyone takes the vaccine, accept it when you are eligible, and follow the recommendations provided by the CDC and the FDA.
All right, I've got 2 quick questions that I'd like you to answer if you would. One is, does it matter whether you get Pfizer or Moderna? Those are the 2 that are available to us. And the second is, does it look as though this is going to need to be an annual shot, much like the flu shot?
So the Moderna and Pfizer vaccines are both mRNA vaccines, and they both demonstrate a similar level of efficacy, you know, around 94-95% for the 2-dose regimen. So given those 2 facts, it should not make a difference which of the vaccines you have. I know that certain health systems and certain workplaces and certain certain distribution centers have one or the other vaccine. Certainly, I encourage everyone to do their research, and if they have questions, to ask their medical provider what they recommend. But for example, if someone offered me either of the vaccines at this point, I would accept either of them with no hesitation.
But it doesn't look, at least at this point, like it's going to have to be one of those that you get all the time, every 6 months to a year.
Oh, and that's another question that the clinical trials are testing. So the participants in the trials are returning for follow-up, and they'll be having blood draws to determine their antibody levels at that point. And that's when we'll really know how long the protection lasts from the vaccines. But it does appear that it will probably at least be a few months. But the data suggests that, it's possible that this will be something that we are all vaccinated for, annually or maybe sooner. We'll have to kind of wait and see.
All right. Now, I want to get back to Venus on this next set of questions. And this really refers to something you've said, and then it was sort of followed up on a more technical level by Dr. Hotez. And it says, data has shown that Hispanics in their 40s and 50s have lost their lives in greater numbers as opposed to the general population. And the general conception that it affects only elderly people over the age of 65. So how aggressive should our approach be in both educating and vaccinating the Hispanic population? And how do we do it? And that's a great question from Ms. Khan.
We deal with this all the time. First, I want to share with the person who wrote this question. There's a difference between Hispanics and Latinos, and one of the things that we're going to really look at when we launch our No Mas, No More campaign, we have over 40 organizations that have signed on, is data collection, how it is being collected, how it's being analyzed, how it is being reported. If you ask, there's some people who are self-proclaiming themselves as Hispanic, but 80% of our population is Latino, and we have to tailor the messaging to be to their level so they can understand it. We can't use words that are unfamiliar to them. For instance, just to give you, Melanie, an example, you go to some of these websites, even the major pharmaceutical websites, and they're using the word ensayos to translate the word clinical trials. They use ensayos, estudios. And what we have found is, when we found this in the EDIC project as well, is that ensayos is experiments on pigs, actually on animals. And it's all right, it's okay to say something like that in Spain and some of these countries in Europe, but it's not okay to say that here. We don't want to invite somebody to become an experiment. We invite them to come to a study. And so, NIH has been great in changing the wording to fit the mold of our culturally and linguistically appropriate for our community. Another thing that we also have looked at is part of the data collection that I'm concerned about is the fact that, some of the informed consent forms, when they translate them literally. And so just to give you an example, I found some that has the word, they translate, are you Black or African American? And they translate it as Negro. And for us in America, we don't like that either. So that would turn somebody from participating. So we just have to really go to our grassroots organization before we're going to tailor any kind of educational program for Latinos. We need to really partner up with those organizations that have developed the trust, that have the trust of our community, and run those words. And promotoras and community health workers are key for that, because they'll tell you that word is too, I don't understand what that word means. And you know, we have seen an upsurge of Latinos, but there's other things that we have to deal with. We have to deal with the surge of domestic violence cases, abuse. I mean, the list goes on and on. The isolation of our elderly, it is amazing what we're having to go through, and this is not it. So when I think of data, I'm thinking of one, real data. Partner up with an organization that works with promotoras and community health workers, then you will get the data you need.
Well, and here's a question that I hear a lot, and this is not only in the Latino community, but also in the Black community, that the vaccine in some way or another affects one's DNA. And I'm sure this is a myth that you've heard over and over again. How do you address that concern that somehow this is, you are an experiment and perhaps your DNA might be altered by the vaccine?
You know, that's the thing. We have to explain it to them at the level that they can understand. You know, it's just like the flu shot. I mean, you know, they affect your DNA. This is not a live agent. We want to make sure people understand that, but we do need to know first where they're getting their information, who gave them that information, and then tailor the answer accordingly. But we always have to listen to their concerns and their questions, and not really make fun of them when they come up with some of those questions. Really respect them and say, okay, you know what, if this is important for you, let me go verify. And that's what we're going to do in the call center.
So they should be able to listen to webinars like this to have some of those questions answered. And really on a different level, how do you bring the vaccine to them? You know, in a lot of cases, people don't have cars. They're not able to take off work and sit in a line. This morning, I think there were more than 1,000 people in a line starting early this morning. How do you get to people who perhaps don't have the luxury of spending all day waiting on a vaccine or certainly something that they're not even sure they need or want?
We really aren't even there yet. We need to really talk to them about even getting the vaccine, not even standing in line, even encouraging them to participate in this, because there's just a lot of fear and mistrust. And with the rhetoric that's been going on in both political scenes and the infighting with science, I mean, they just don't know who to trust. And that's what we're fighting for, is for them to get the credible information and that's verified. But we need to get that information so they can understand it in order for them to trust the system and say, okay, I will work with this hospital, this clinic to get the vaccine.
So,
Dr. JK, I was going to bring you in on this, so please go right ahead.
Oh, no, I was just going to point out that we were 2 minutes past the time that we had set for this session. There's so many good questions I see in the Q&A. We have recorded them, and I think what we will do is we'll get the panel, relevant questions into the panel, and we'll try to address the questions and send answers to the participants. I mean, I'm really happy that there is tremendous enthusiasm, so many questions coming up. It is just that looking at the hour, you know, we don't want to delay our panelists too. So,
well, JK, I appreciate that so much, and I'm glad you mentioned it because I've been watching my clock up until the moment we started doing questions, and there were so many fascinating topics here. So I will certainly turn it back over to you, but thank you so much for allowing me to be part of such an important topic.
Yeah, and I, you know, on behalf of all of the Texas SEAL members, I thank you, Melanie, for this great job that you have done, along with all our panelists, Dr. Monica Webb Hooper. Thank you so much for all the support that you have provided. Ginés, you are part of our team, and you know, I'm very happy. I know that the two of the other panelists had to leave early because they had other engagement. This is just first of the town halls that we have conducted from the Texas SEAL. I can already see the tremendous enthusiasm in the community. In the question and answer already was asked, When are we going to have a similar one in Tarrant County? So, so there definitely is a lot of interest in this. So I really thank all of you for taking your time, all the participants and the panelists. And this was a very, very engaging event. And I hope that we have provided some information that will be useful for individuals and communities to make up their mind. So thank you very much for participation in this.
All right. And can I just also issue a shout out to Molly O'Brien, who has been really helpful, Dr.
Yes.
JK. So I want to mention her as well.
Yes, thank you all very much. And thank you. Have a good evening, all of you.